Yes, boss.
It's December 1941 in Casablanca. What time is it in New York?
What? My watch stopped.
I bet they're asleep in New York. And I bet they're asleep all over America. Of all the gin joints in all the towns in all the world, she walks into mine.
Ain't love hard. But anatomy and physiology is harder, so we got to get back to work. So in Chapter 8, we're going to study the joints of the body and finish out the material for Exam 2. If we didn't have joints, we would not be able to carry out many of life's functions. Movement would be very difficult, and dancing would be out of the question. I just love this guy's moves. There are two ways to classify joints, by their structure and by their mobility. This terminology used for classifying joints is some of the most confusing, so I will clarify and simplify this terminology. The three structural classifications are fibrous, cartilaginous, and synovial. The three functional classifications are immovable, slightly movable, and freely movable. The three types of fibrous joints are the sutures that we saw in the skull, interosseous ligaments that hold bones together, and the ligaments that hold teeth in place. Two types of cartilaginous joints are those held together by hyaline cartilage, such as the epiphyseal plate, or those held together by fibrocartilage, such as the intervertebral discs and the pubic symphysis. And the third classification of structural joints is the synovial joint. We'll spend the rest of this video and the rest of the chapter on the synovial joint. As far as functional classification goes, the fibrous joints tend to be immovable, synovial joints are freely movable, and cartilaginous joints range from immovable to slightly movable. Synovial joints are the most common joints in the body, and there are structures common to all of them. Let's take a look at those structures more closely and discuss their functions. Synovial joints are composed of two bone surfaces covered in hyaline cartilage. The cartilage functions to absorb compressive forces, but also provides a smooth, lubricated surface for smooth motion. This cartilage is known as articular cartilage. The space in between the bone surfaces is called the joint cavity, and this cavity contains a small amount of synovial fluid. The joint cavity is enclosed by an articular capsule. The capsule is made up of an outer, tough, dense, irregular connective tissue with an inner layer of loose connective tissue and cells called the synovial membrane. It is the synovial membrane that produces the synovial fluid. The term synovial comes from the prefix syn, which means together, and the root word ovi, which refers to egg, because the fluid resembles egg white. The synovial fluid is essential to the proper function of a synovial joint, and we will discuss in greater detail in class the importance of this fluid. Make sure that you read this section of the textbook on the structures of synovial joints so that you are ready for these discussions. The joint capsule alone would not be enough to stabilize the joint for it to function properly, so there are numerous ligaments that help with this process. Again, we will elaborate in class regarding the functions of all of these structures and the potential issues that can arise during injury. Those are the typical structures of all synovial joints. In addition, synovial joints may have other structures that enhance their function, such as articular discs, also known as menisci. Menisci function to make the joint more stable and minimize wear on the joint surface. The knee is the most well-known joint to contain menisci, but there are others. We will examine the knee joint more closely at the end of this chapter. Now, some other structures associated with synovial joints that are not part of the joint are the bursae and the tendon sheaths. Bursae are fluid-filled sacs that reduce friction between structures, and tendon sheaths are elongated bursae that wrap around tendons, reducing friction as well. Both of them can get quite inflamed and very tender. The most well-known bursa is the bursa in the shoulder called the subacromial bursa, and this causes the famous bursitis in the shoulder. In class, ask me about a condition called stenosing tenosynovitis. The factors that influence stability of a synovial joint determine both the stability and the flexibility of the joint. And those factors are the shapes of the bone surfaces and the soft tissues that cross and surround the joint. These soft tissues are the joint capsule, ligaments, and tendons. And if we contrast the hip and the shoulder joints, we can get a good idea of how strongly these factors play a role. And we will do this in class. The last topic we will cover in this video is joint movements. Movement is accomplished by muscles. We are basically made up of a string of bones held together by soft tissues that include muscles. What kind of movement a muscle creates depends on the type of joint and the direction of muscle fibers. And in Chapter 10, we will explore these muscle movements. Kinesiology is the study of the mechanics of body movements, and it is a fascinating topic. We will discuss kinesiology here in a very basic sense. Synovial joints allow bones to slide or glide on one another along an axis. Gliding motion is referred to as translational. Synovial joints also allow angular movements around an axis. These movements are referred to as rotational. The axes that I have been referring to are the basic x, y, and z axes of the Cartesian system. And in kinesiology, we borrow this graphical representation of our 3D world to explain biomechanics. Let us give ourselves some reference points so that we can understand the terminology that is used to describe movement. Beginning with the y-axis, our reference for this axis is the superior to inferior or vertical axis. The x-axis is a left-right axis, and the z-axis is an anterior to posterior axis. Let's now see how this relates to our physical structure. If we copy and paste our axes, rotate around the y-axis 180 degrees, rotate again around the x-axis another 180 degrees, voila, we have our 3D axis system. And in this picture we can see three planes associated with these axes, which might look very familiar to you. I will leave you here and let you stew on this information for a while. Take a look at these pictures of the shoulder joint showing the three axes and their associated rotational movements, and we will pick up right here in Part 2 of Chapter 8. Wait, don't click out yet. There's a big event that has happened in Dr. D's life. She is an aunt again, and with a new baby in the family, she just has to talk about fetal position. What does fetal position have to do with movement? Well, flexion of a joint will bring that body part into fetal position. This is an easy way to remember the difference between flexion and extension of a joint. And in general, adduction will also follow the same rule. So flexion and adduction will tend to compact our bodies, and extension and abduction will open us up. Okay, now we can end the video. See you in class.